In this video, we will be reviewing the post-op care after a total knee replacement. After your total knee replacement, there will be precautions in place that we want you to follow for 6 to 8 weeks while you are healing. Make sure that you avoid twisting or rotating from your knee. When you are walking, take small steps, keeping your feet in line with your body, especially when turning. And we want you to get up every hour, but only 5 to 10 minutes. It's important that you don't overdo it. You will be getting up only during the day. Don't set an alarm to get up at night. Pain and swelling after surgery. Significant pain, swelling, and even some bruising is normal after the surgery. There will be pain after the surgery, and it can vary from time to time. Some days will be good, some days not so good. Swelling will also start to set in within the first few days after surgery. And you will also start to see some bruising. As you can see in the image, patient A has a lot of bruising in the back of the leg and patient B not so much. Some patients bruise a little bit more than others. Just expect to see some bruising either in the front or the back of the leg, and this will start to develop within the first week after surgery. Elevation is key to keep the swelling down. These are examples of how not to elevate your leg. Avoid placing a pillow underneath the knee. This image shows proper elevation. As you can see, the pillow has been placed underneath the heel and nothing underneath the knee. Elevating above the heart level will give you better results. Ice will help with pain and swelling after your surgery. You will receive an ice pack at the hospital to use after your surgery. Use the ice packs as frequently as you need, but no more than 30 minutes every hour. Be sure to have clothing or a thin towel between the ice pack and your skin to avoid frostbite. You can ice anywhere on the leg that is painful or swollen. Compression will also help keep down the swelling. At the hospital, you will receive compression stockings, and we want you to wear them during the day for 4 weeks or until the swelling goes away. You may remove them at night. If the socks ever become too uncomfortable, difficult to put on, or if you have no help getting these on, you can stop using them as long as you continue to ice and elevate. Something else that will be placed on your knee is an ACE wrap. Your surgeon will place this after your surgery. Your surgeon would like for you to leave it on for the first 24 hours. After the 24 hours, you may remove the ACE wrap and leave the area open to air. After that, you can use the ACE wrap as needed for compression around the knee. We recommend that you use it during the day and remember to take it off at night. Multimodal pain management. Make sure you're taking your pain medication regularly based on the severity of your pain. You will have pain medications that are mild, such as Tylenol, Meloxicam, or Celebrex. Make sure you take those on a schedule to stay ahead. You can use the stronger narcotics, such as tramadol and oxycodone, as needed for moderate to severe pain. If you're taking the Tylenol and the Meloxicam, or the Celebrex, and those two are working to control your pain, continue that schedule. If you start having a little bit more pain, you can add the tramadol. If you have very severe pain, you can add the oxycodone. Just make sure you always wait 1 hour between the tramadol and oxycodone, as both of these can be very strong. Track and wean off your narcotics as soon as you're able to. Narcotic pain medication and decreased mobility can cause constipation. You will have stool softeners and laxatives to take as needed for constipation. And be sure to get plenty of water and dietary fiber as well. Blood clot prevention. We will prescribe you a blood thinner to take after your surgery. Blood thinners such as aspirin, Eliquis, or Xarelto are commonly used. Be sure to take it every single day in the morning with food. Take it for 30 days. It is important that you take this without missing a dose. Peripheral nerve anesthesia catheter or pain pump. This catheter is used to help treat post-op pain after your knee replacement, aside from taking your oral pain medications. This will be placed after your surgery as you are waking up from anesthesia. An ultrasound will be used to help guide the small tube to be placed near the nerves that supply your surgical incision. As you can see in the image here, it will be taped and secured to your thigh. Your doctor will set the rate for you. The pump will be automatically infusing, and your only job is to carry the pump with you wherever you go. There is enough medication in the pump to last you for 5 days. On the 5th day, you will remove the pump at home yourself. Pain pump removal. You will remove the pain pump at home yourself. We recommend that you remove it in the morning so that if you feel a slight bump in pain, you have enough time to catch up before nighttime. You or your care partner can remove the catheter. Sit down or lie down before removing it. The person removing the catheter should wash their hands. Start by peeling up on the edge of the bandage and continue to peel until the entire bandage comes off. The catheter is attached to the bandage, and it should come out with the bandages with a steady, gentle pulling pressure. After the bandages are removed, please throw it all away in your regular household garbage. In the insertion site, hold pressure for about 5 minutes with a clean towel, gauze, or a Band-Aid. Leave the Band-Aid on over the catheter hole for a day or 2. Dressing tips after surgery. Make sure you always sit to get dressed. You are at high risk for falling. You can dress normally without the need for adaptive equipment as long as you have the flexibility to bend down and put your pants or your socks on without crossing your legs. Dress your operated leg first as it has limited mobility. When you undress the operated leg last for ease. If you don't have the flexibility to bend down and put on socks, you can use a sock aid. The sock aid will not work with compression socks. How to use a sock aid. You can place the sock around the device in the way that you want it to fit on your foot. Once you have the sock on, throw the device down onto the floor. Slide your foot in and pull the straps so the sock slides on. Remember to wear loose-fitting clothes to the hospital and while you're at home recovering. With the pain pump, the nerve block that you will have on your thigh, plan to put underwear and pants and allow for that line to come up the top of the pants. Do not thread through the bottom. Adaptive equipment that we recommend for after surgery. Please note that this equipment is not covered by insurance and if needed would have to be purchased privately. The reacher shown here can be used to help pick up things off the ground or to help you get dressed. The sock aid can help put on socks if you have no care partner to help you. The handheld shower head for ease in the shower. Long-handled sponge to help reach down into the lower leg area. The long-handled shoehorn to help put your shoes on. And the leg lifter, which can help lift your leg in and out of bed and in and out of the car. We recommend you use a front-wheeled walker over a four-wheeled walker. Walkers are sometimes covered by insurance. If you have questions on how to get one, please let us know. We want you to use a walker for 2 weeks initially, no matter how good you feel. Showering. After your pain pump has been removed, you can shower. Your bandage is waterproof. You can shower as long as your bandage has all of the edges sealed. Make sure you are not soaking in a bathtub, pool, or a hot tub. Be sure to have someone with you the first couple of times that you shower. When you shower, you will let water run over your body. Try to stay away from the edges of the bandage. And when you're done, pat dry. Make sure you keep a bandage on the incision until your follow-up appointment. In this image, you can see the drainage that is normal after your surgery. The drainage can vary from person to person. If the drainage is ever not contained by the bandage, please call our office to let us know. Showering. Use a shower chair for at least 2 weeks after your surgery. If you have a tub shower, you can use an adaptive equipment such as a tub transfer bench to transfer safely in. You sit on the bench from the outside and slide across to avoid excessive bending. If you have a walk-in shower, you can use a shower chair for safety. If needed, place the walker nearby so you can get in and out of the shower. Home medical equipment. Occupational therapy can help discuss bathroom equipment as needed to help improve your independence. If you would like more information, you can ask to speak to an occupational therapist at the hospital after your surgery. We also recommend that you use a toilet seat riser for elevated height if needed, or a toilet safety frame to help support when you're getting up off the toilet. Transfers. Make sure you choose chairs that are comfortable, have armrests, and have the ability to elevate your legs. Don't sit on chairs or couches that are too low, as they can be hard to get in and out of. And make sure you always push off grab bars or chair arms instead of pulling up on your walker. Is your home ready for you? Arrange to sleep on the side of the bed closest to the bathroom. If you frequently get up at night to use the bathroom, try to avoid rushing and moving too fast. This is when falls tend to happen. Have a night light or a lamp ready to go for safety at night. And make sure you move slowly when turning and backing up. Check railings to see that they are not loose. In the bathroom and throughout your house, pick up all throw rugs. We also recommend getting a walker bag. The walker bag is helpful so you can carry your phone, your water, your handouts, and important items that you want with you. You need a care partner to stay with you for at least 3 days after surgery, preferably 1 week. Ensure that you have a plan or that your support person will assist you with transportation to follow-up appointments, physical therapy. If you're having your left knee replaced, we recommend no driving for 2 to 3 weeks. If you're having your right knee replaced, no driving for 3 to 6 weeks. When you go to your follow-up appointment, your doctor will instruct you on when you can resume driving. Make sure you have a plan for shopping and meal preparation, housekeeping, pet care, yard care, and maintenance. Therapy expectations at the hospital on the day of your surgery. Physical therapy will meet with you after your initial recovery period. The goal is to assess your mobility right after surgery and the level of assistance that you will need. They will then give you education on walking with your walker, stair training, and talk to you about how to get in and out of the car. Occupational therapy will also be available to meet with you on the day of or morning after your surgery. Their goal is to maximize your ability to do what you normally do independently after your joint replacement. They will review education, including safety and accessibility to your daily activities. They will educate you on transfers, for example, how to get in and out of the shower, the toilet, and the car. They will assess your ability to move around, how you can access your bathroom, kitchen within your home, and also how to use the adaptive equipment such as the reacher, sock aid, and the leg lifter. Before your surgery, please refer to your educational packet that you will receive at your pre-op appointment or watch this video again if needed. And make sure you practice at home. If you have further questions, you can call me, Syra, your orthopedic nurse navigator. I'm available by phone Monday through Friday from 8 a.m. to 4:30 p.m.